Hi guys, my name is Mandy Ruffin. I chose the topic physician assisted suicide or physician aid in dying for my topic for this presentation. I decided to choose this topic due to the fact that I really wanted to choose something that I wasn't very good at. Talking about death is not my strong point. I know that a lot of people see it as a taboo subject. Nobody wants to talk about it. For me, it's very emotional. And so I really wanted to be able to search something that would, um, help me later in my nursing career and be better at something. When thinking about what I wanted to do about death and dying, I remembered a story that I had read about a 29-year-old woman named Brittany Maynard. She was diagnosed with brain cancer and she was given 6 months to live. Um, they decided as a family, upon doing a lot of research on this, that she was going to do radiation treatment. They also knew that with the radiation treatment, her hair would be singed and be gone. She would get sores and burns on her scalp, and just overall, her quality of life would essentially be gone. After months of research, they realized that there really was going to be no cure for her disease. And it would destroy the life that she had left with all the treatments. And she didn't really want to suffer through weeks and months of cancer eating at her mind. And she didn't want to see her family suffering by watching her. So she decided to research death with dignity. And when she researched this, she found out that there's about six states that do have this legalized where you can get a lethal prescription that will aid in your dying. There are a lot of things that you have to do to qualify for this. One of them being you have to be a resident of that state. So Brittany didn't live in a state where it was legalized, so she moved to Oregon, which Oregon was the very first state that had legalized this. She up and moved her family and became a resident, jumped through all the hoops that she needed to, including paperwork, um, going through a mental evaluation, and jumping through all the hoops to become a resident of a state. She did eventually get the prescription, and she decided that she was going to spend her husband's birthday with him. And then soon after that, she was going to take this prescription. Well, she did spend his birthday with him, and she died with dignity and respect in the comfort of her own home, surrounded by her family and her friends. And I think this is really important because she did say, I didn't want to die, but I am dying. And I want to die on my own terms. She wanted a choice. And I think that's so big because that's that for nurses, we're taught a lot at Methodist about patient autonomy and really listening to our patients. And I think this is so big. And, she just wanted a choice. She didn't know at that time if she really was going to use the prescription when she originally got it, but she wanted that choice to be able to choose. And I think that's really important. So major findings and strengths and weaknesses that I found in the articles that I read. The first one was The Right to Assisted Suicide, written by Esther B. De La Torre. And this one supported the patient autonomy. They stated that they thought terminally ill patients had the right to assisted suicide because it's the best means for them. It's their choice. There's illnesses that, drugs and surgeries can't cure, and the patient is just suffering. They think that a competent terminal patient must have this option. And they should be allowed to die with dignity with their own families and save their families from suffering, financial ruin, and just be relieved from unbearable pain. The second article that I read was by Dr. Thomas Strauss called The End of Life Options and the Legal Pathways to Physician Aid in Dying. This one I felt was very interesting. He discussed several approaches to the topic, including evidence-based approach, a broader range of choice approach, and an informed person-centered approach. So the evidence-based approach discussed how providing a lethal prescription is a violation of the Hippocratic Oath, and there is no circumstance in which it should be ethically okay for a physician to do this. The broader range of choice approach and the informed person-centered approach discuss these patients that were denied access to this legal prescription when their cancers and their quality of life were at its worst. And they ended up, because they had nowhere to turn and no other options, they ended up committing suicide in quite gruesome manners. And so they think that if these men were given more choices, that their outcomes for them and their families would have been drastically different. It's not the decision of the providers to provide assistance to these patients, but due to ethical reasons, it shouldn't stop them from referring these patients to others who will give this care to them if it's ethically against their morals. And so Dr. Thomas Strauss concluded that he believed that the end of life is the most inappropriate time for these physicians to turn patients away. If they're not going to do it and they don't believe in it, that's fine, but they can't just turn these patients away and say, I don't believe in that, good luck, see you later. They need to then guide them to somebody that will fulfill their wants and their needs. And I thought that was very interesting. The third article that I read about was Toxic Abandonment, a case for non-participation in physician-assisted suicide by Alva B. Weir. And this was actually in response to Dr. Strauss's article. And in this one, Dr. Weir discusses that many patients with terminal illnesses face unbearable pain and suffering, both physical and mental. It's just not about the physical aspect of this. It's mentally, they are depressed, they're hopeless, they're sad. I mean, they need someone. And this is the time where, these physicians can't turn them away. It's important for the physician to maintain trust and those whose health is declining, not to imply that their illness makes their life not worth living. And so they're saying that, if these physicians, it's not the physician's choice, it's the patient's. So I thought those articles were very interesting. I did interview Miss Kathy Barnes. A lot of you may know her as one of our instructors. She does a lot with our hospice and palliative care teaching in Nursing 340. I remember when I found out we were going to hospice house, I was very anxious. And I went to hospice house, and Kathy just has this presence and this calming for these patients, and I think that was very calming for me as a nursing student. When talking to Kathy, she supports the position of the American Nurses Association, where it prohibits nurses' participation in assisted suiciding and euthanasia because these acts are in direct violation of the Code of Ethics for nurses. And she believes that there's a huge team of providers that are taking care of these patients when they are dying, and that, there is nothing bad that can come from having a good conversation. And what she means by that is, really talking with all these providers and the patients and their families. You can get a lot done, and that doesn't always mean that physician aid in dying is the right choice for these patients. She had a lot of good insight on this matter, and I think it was very interesting to see how she viewed these topics. Some gaps that I found in my research was the toxic abandonment article was very one-sided. They didn't really look at all the approaches to this topic. They were very one-sided. Um, Unlike Dr. Strauss's article, even though he may not have believed in these different approaches, he researched them and kind of discussed them. Some future research that I think is very important. I think it's very important to educate these patients on the different options that they have. And it's very, very important to educate these physicians and healthcare providers on the ways that we can help the patient to not just treat their illness, but to treat the patient as a whole. I think education is key, communication is key, and that's something that I am proud to say that Methodist is very good about doing for us nursing students. I did a lot of research with this. Here are my references, and I could probably talk all day about this subject because it's very interesting to me, and there's still a lot to learn. But thank you very much.